And the next topic is intestinal infection. Intestinal infections are those infectious diseases which are caused by basically by intestinal group, and namely by the family Enterobacteriaceae. If we're talking about taxonomy of this bacteria, here we can see it starts from bacteria, protobacteria, gamma protobacteria, Enterobacteriaceae, and Enterobacteriaceae family. So this family includes over 30 species. Talking about morphology of this bacteria, first thing we have to mention here is that Enterobacteriaceae is gram-negative bacteria. It will make more sense, and you will see in you will see in this presentation, in this lecture, why it makes sense. So the majority of Enterobacteriaceae are facultative anaerobes. That means they could multiply in both cases in aerobic and anaerobic conditions, which makes them to be more resistant in different conditions. They are fermenting sugars and produce lactic acid and other various end products. So the majority of Enterobacteriaceae, they have flagella. They are motile. You can remember we were talking about properties of motility of different bacteria. So some of them could be monotrichous, amphitrichous, lophotrichous, and peritrichous. Here you can remind the difference between these kinds of motility. Meanwhile, not all of them are motile. Some of these bacteria are not having flagella. And also they are not spore forming. So this bacteria doesn't produce any spores. Talking about key test for Enterobacteriaceae, key test will help you to identify basically family of bacteria, to identify Enterobacteriaceae. So key test will show that it is rod-shaped bacteria, that it is gram-negative, that it doesn't form spores. Some of them do produce capsules, some of them doesn't. They are motile, but not all of them, and that they are facultative anaerobes. Talking about primary test will help to identify genus. There are different genuses of Enterobacteriaceae which are causing different diseases, different infections. For this purpose, we can use different methods of diagnosis, different substances, and different culture media. For example, such tests like Vaux-Proskauer test, and this test shows if the bacteria is able to digest the glucose. Also, we can identify motility of these bacteria by multiplying by culturing of these bacteria in semi-liquid culture media, and we can use such culture media as triple sugar agar, which shows difference between different genuses of bacteria, of Enterobacteriaceae. Talking about a secondary test which can help detect species, here we are talking about indole test, the His medium, which shows fermentation of different sugars, and phago identification. also antigenic structure and sensitivity for antibiotics. Whenever we are making test for culture media, whenever we are making test for Enterobacteriaceae, for intestinal group of the intestinal group infections of intestinal group, in such cases we can apply such culture media as selective culture media and as differential culture media. So let's remind quickly which is the difference between selective and differential culture media. Whenever we are talking about selective culture media, that means we are using specific culture media which will help to select, to grow, to multiply specific type of bacteria. Talking about intestinal group, what it is important to know about the entire intestinal group is that all of them are gram-negative bacteria. So whenever we are looking for bacteria for pathogens in intestinal group, we have to look for gram-negative bacteria. Since we usually we have to detect them in feces, so it is called coproculture. Whenever we are making coproculture, first of all, the first step we have to make is to apply selective culture media, which will help some specific type of bacteria to grow on this bacteria. Selective culture media gives possibility to grow just to in intestinal group. It gives a possibility to grow just to gram-negative bacteria. So it has it can inhibit growth of gram-positive bacteria. And next, we can identify from this culture media. From this culture media, we can identify different genuses and different species. Talking about differential culture media, in this case, we already have applied selective culture media, which help us to make the first filtration, the first selection of the gram-negative bacteria, and among them we already can find some more specific genuses and specific species. So differential culture media usually will show us difference in metabolic functions of different bacteria, because in the same genus we can have more species of bacteria with different metabolic functions. Some of them are able to ferment glucose, some of them are not, some of them are able to ferment lactose or sucrose, and some of them are not able, some of them are able to produce gas or H2S, and some of them are not. So all of these features of such bacteria are showing us which genus and which species we are finding here. One of kinds of identification of Enterobacteriaceae is lactose fermenting versus non-lactose fermenting bacteria. And here we have an example of MacConkey Agar. MacConkey Agar is such kind of culture media which includes two types of culture media. First one is selective and second one is differential. Selective function again helps to multiply in the culture media just gram-negative bacteria, and differential one shows if the bacteria is able or not to ferment lactose in this very case. So in case of lactose fermenters, lactose fermenting organisms will appear as pink colonies here. Here you can see they do ferment lactose and the colonies are pink. And others are non-lactose fermenters. They are colorless, but meanwhile they are able to produce pink color among them. And here you can see different genuses of lactose fermenters and non-lactose fermenters. Talking about lactose fermenters, it's Citrobacter, Escherichia, Enterobacter, and Klebsiella. Whenever we are talking about non-lactose fermenters, It is about Shigella, Yersinia, Proteus, and Salmonella. And here also you can see lactose fermenters and non-lactose fermenters. Regarding antigenic structure of Enterobacteriaceae, we have 4 types of antigens. Since all gram-negative bacteria, they have outer membrane. The first stage is outer membrane. Some of them do have flagella, some of them don't have flagella. So the majority of them, they have flagella, so one of the majority of them will have H antigen, flagellar antigen. And also some of them do have capsule, some of them doesn't have capsule. K antigen is showing presence of capsule. And whenever we are talking about VI antigen, it is about salmonellic capsule, capsule of Salmonella genus. Talking about the habitat of Enterobacteriaceae, you can easily deduce that Enterobacteriaceae normally are found in the intestine, both humans and animals. And it depends about which species we are talking about. So some species are normally, or some genuses are normally found in human intestinal tract. Some of them are normally found in animals. Which pathologies they can cause? They can cause intestinal infections, systemic infections, which means sepsis, and nosocomial infections, or healthcare associated infections. Talking about different types of bacteria, we can start with Escherichia. Escherichia is normal is making part of normal flora in the intestinal tract. So there are a few types of Escherichia coli, and we can start with Enteropathogenic Escherichia coli. So Enteropathogenic Escherichia coli, it belongs to a group of Escherichia coli which is known as pathogen which has ability to attach the surfaces, and it is able to produce some specific lesions on surfaces of intestinal epithelial cells. Also, we have Enterohaemorrhagic Escherichia coli, and according to its name, you can understand what means this bacteria. This bacteria is able to produce intestinal bleeding. Also, the toxin produced by Enterohaemorrhagic Escherichia coli is called Shiga toxin. So this Shiga toxin is producing these lesions in the intestinal tract. Also, we have Enterotoxigenic Escherichia coli, and this kind of bacteria is able to produce. Usually, it produces diarrhea or intestinal infection in travelers. Usually, it is endemic. And also it is known as infection which causes very high mortality among children. Also, we have Enteroinvasive Escherichia coli. Both Enteroinvasive Escherichia coli and Shigella species are able to produce Disentery, which is also called shigellosis. So not just Shigella species are producing shigellosis or Disentery, but also Enteroinvasive Escherichia coli. However, it was demonstrated that Shigella clearly belongs to a species of Escherichia coli. Also, we have Enteraggregative Escherichia coli. It was identified as a cause of infection during 1980s, and it's defined by the aggregative patterns of adherence to tissue culture cells. And the last one is diffusely adherent Escherichia coli. Talking about laboratory diagnosis of Escherichia coli, there are three main types of laboratory diagnosis. First one, of course, is bacteriological. Basically, you will almost never start any lab investigation of intestinal infections unless you will make bacteriological or culturing of these bacteria, so bacteriological investigation. On this stage, we will obtain the pure culture of the bacteria, and actually we can move forward. The kind of investigation is the direct one, is direct investigation, because we have the pathogen itself. The next one is serological test. Serological investigation is helping to find antibodies. Usually for serological investigation we are taking blood or serum. Here we can apply agglutination reaction with Escherichia coli, and also we have rapid tests, which are including identification of pathogen in reaction of immunofluorescence. Talking about dysentery, dysentery is intestinal infection caused by genus Shigella, and also called shigellosis. It is an infectious disease with a fecal-oral mechanism of transmission, and it is characterized by severe diarrhea. Also, very often this severe diarrhea could contain some blood or some pus. Taxonomy is it is also coming from Enterobacteriaceae family, genus Shigella, and it contains more species such as Shigella boydii, Shigella dysenteria, Shigella flexneri, and Shigella sonei. These are four main species which are causing shigellosis or dysentery. Having the gastrointestinal route of infection, this disease is causing severe diarrhea. It is able to destroy the epithelial cells of the intestinal mucosa and in the cecum and rectum. So this could lead to intestinal bleeding. And as well as I told, stool may contain blood or mucus or pus. It will depend on severity and on localization of infection. Very often it produces severe diarrhea. Usually it lasts few days, but it can increase up to few weeks. And the disease very often is self-treated, so usually disease is finishing by itself without any specific treatment. However, it would be, of course, very important to apply some symptomatical treatment. So it could be rehydration. In every kind of intestinal infection, it is very important to replace all the liquids lost from the body and all the electrolytes lost from the body, and of course nutrients. Whenever we have fever and abdominal pain, of course, in order to make it to pass easier and to give some strength to the body, we are applying this symptomatical treatment. The diagnosis of Shigella, basically they are not produce any gas from carbohydrates. So in differential culture media, in comparison with other pathogens, Shigella does not produce any gas. However, Salmonella, for example, some of species are able to produce gas. And also, Shigella should also be urea hydrolysis negative. We apply triple sugar iron agar, and Shigella reacts Shigella reacts with this culture media in the following way. It glucose fermenter, it doesn't produce any gas, and it doesn't produce any H2S. Talking about indole reactions, they could be both negative and positive, with the exception of Shigella sonnae, which is always just indole negative, and growth on the Hictoin enteric agar will produce bluish-green colonies for Shigella, and bluish-green colonies with black centers for Salmonella. Well, talking about the treatment, persons with mild infections usually are quickly treated without any antibiotical treatment. However, antibiotics could be of a small help, so it will make the treatment few days faster. However, very often Shigella are becoming antibiotic resistant. This is why not all the time it is worth to apply antibiotics. Anyways, ampicillin and other types of antibiotics could be applied in the treatment of shigellosis or dysentery. Well, even if antibiotics might not be effective in the treatment, if we are talking about severe forms and more people affected with this infection, we can apply some treatment with antibodies taken from treated person. So that's all for this topic. Thank you for attention.